Carpal tunnel syndrome affects a lot of people. Who can suffer from it?
Yes, actually, CTS or carpal tunnel syndrome is the most common pathology that a hand surgeon will see. So it's very common, and it affects typically women after the age of 50. It probably has to do with hormonal imbalance. It usually affects both hands, but not necessarily at the same stage or same time. Men can get it too, but with less frequency. And it can also be associated with specific activities, jobs that are really heavy, repetitive motions of the hand and wrist. It's also most common in people who suffer from diabetes or people who have problems with the thyroid gland.
What are the main symptoms?
Patients complain of night pain and they're awakened at night. The hands go numb. They feel pins and needles. Sometimes they'll describe burning pain in the hand and the wrist. That's caused by nerve entrapment. Sometimes they'll describe those symptoms when they're performing certain activities like flexion of the wrist, extension of the wrist, driving, speaking on the phone, reading a paper or magazine. Then with time, they'll start losing sensation in the thumb, index, middle, and ring fingers, and that loss of sensation can become permanent. They'll also describe muscle atrophy here, so they'll lose muscle at the base of the thumb. Once we're at that stage of advancement, which is pretty advanced, the patient will have loss of dexterity, will become clumsy, will have a hard time, buttoning shirts and tying shoelaces.